Hello, welcome to our educational session called Treatment of Flu and Similar Viral Infections. If you are watching this today, it's very likely that you have either been exposed to the flu or you are uh, experiencing the flu yourself. So this is a much shorter educational session than we usually do at Med Group, but it's for purposes of your understanding the medication you're about to receive for the treatment of flu or prevention of flu. So we'll talk a little bit about how that looks. So we're going to talk about what is the flu, very simply. What is the treatment sometimes needed and why is it needed? How long will it you need to take the medication and other things I need to know about the medication. So the flu is a respiratory illness. It's contagious. It's caused by the influenza virus. It can cause mild to severe illness and sometimes can lead to more serious complications, so we want to make sure that we treat you effectively and quickly. Flu symptoms usually come on suddenly. People who have the flu often feel some, if not all, of these symptoms. So I'll run down the symptoms. You may be feeling these now. Fever, feeling chills, having a cough or sore throat, runny nose, or your stuffy nose either, could go either way. Muscle or body aches, headaches, feeling tired. Sometimes people can have vomiting and diarrhea. It's more common in kids than adults, but it's possible. And not everybody will have a fever with flu. Flu can have a lot of different types and presentations in different people. Why is treatment needed sometimes? Because if you may be infected and contagious, treatment is prescribed with the purpose of decreasing your symptoms and to decrease the chance you will infect other people. You may have been exposed to somebody who was infected and contagious, and we want to prevent you from getting the flu itself. And prevention treatment is what we would call treatment to prevent you from becoming infected if you were exposed to somebody who has the flu. So again, you may want to ask if you have the flu or if you're just being protected from the flu. Either way, you may be receiving something called Tamiflu. Oseltamivir is the name of the medicine. This presentation is going to quickly review the medication information about that drug you're receiving. But you may have also been prescribed a different type of antiviral. Paxlovid, for example, if you have COVID infection. The amount of time you'll be prescribed, the treatment will vary based on the person, based on the infection, but you can ask your doctor, nurse, or pharmacist about the expected time you will receive the medication prescribed for you. You will also be receiving a paper copy of information about the medicine you're receiving. Your pharmacist will co-sign this paperwork with you most likely so we can ensure you receive this important information. The sheet you're going to be getting today, or let's say around this date, is something that was updated in 2024. So whenever you're getting information about your medication, make sure it's the most recent version or edition. There can be updates to this information, but it's not always the case. And for example, this information that you're receiving today is in 2025. So just know that it's accurate and up to date as of this point. If you ever have any questions about your medication, you would want to ask your doctor, nurse, or pharmacist. So this paper that you're receiving today is information from the FDA, and they are the oversight committee to see that medication is used safely. And so I'll just read through some of this information with you. So oseltamivir is how you pronounce it. Prevents and treats infection caused by the flu. It works by slowing the spread of the flu virus in your body and how long symptoms will last. It reduces that duration of time that you'll have symptoms. It does not treat colds or infection caused by bacteria or other viruses, and it will not replace your flu vaccine. This medication may be used for other purposes, so ask your doctor or pharmacist if you have questions. It's not always the case, but it may be the case. And I will just say that even if you've had the flu vaccine, sometimes the flu that is circulating, the actual infection, is slightly different than what was predicted for the flu vaccine. So don't lose heart on getting your flu vaccine. It's important to get that every year, even if there's a different flu strain circulating. What should I tell my care team about before I take this medication? You need to know if you have any of these particular conditions, if you have any swallowing challenges or difficulty, if you have kidney disease. We don't always know, so if you do know, let us know. Unusual reactions to this medication in the past or any other infections, allergic reactions, would I rather say, to this medication or others. If you have any concern about being pregnant or have questions about being pregnant. How should you take this medicine? You take it by mouth and with water, just as described by your nurse or doctor. You can ask your pharmacist. You should take it. It can be taken with or without food, but if it upsets your stomach, you can maybe ask for a small snack for that. Taking all the medication is important unless your team tells you to stop taking it. For example, if you have a reaction to it. So you should keep taking it even if you think you're feeling better. A lot of times viruses can become mutated and stronger if we don't take our medication that's prescribed for the entire course of treatment. When taking whole capsules, you should swallow them whole, don't crush or chew them. And if you have trouble swallowing, like I mentioned before, your nurse can help you create the medication capsule contents to be mixed with liquid so that it's easier, but if possible, try to swallow it whole. And this medication is only for you, don't share with others. I know in the hospital setting that we're in, that's not usually the case to even worry, but when you're out in the community, you should make sure that you're not sharing medication with others. And it's interesting to note that this medicine, Tamiflu or oseltamivir, is given to different doses based on the person's health condition, so you may get a different dose than a person also on your unit getting the same medication. If you miss a dose, it's not likely going to happen here, but again, if you're in the community and you're on this medication, just try to take it as soon as you remember you forgot, and if it's almost time for your next dose, within 2 hours, just take that next dose. Don't double or take extra doses at the same time. To interactions and medications that would not be a good mix with this medication, it's really important to share with your healthcare provider other things that you're taking. If you are taking anything over the counter or anything that's not routinely prescribed for you or in the community, I would hope that you're not smoking cigarettes, but if you smoke cigarettes or have any kind of ingestion of other things, you need to make sure that you're letting your doctor or pharmacist know so that they can help with that dose adjustment if needed. Side effects you may notice from receiving this medicine, probably more common than not. Some people get headache, they get a little nauseous, and they may vomit, but that can also be part of the flu, so it's hard to know either way. But these usually aren't serious. They go away with, with resolution of your other symptoms, so they're usually not to worry. It doesn't describe all the side effects in the insert, so if you notice anything unusual, you'll want to let your doctor know. Things that are more concerning, allergic reaction, any kind of blistering or redness of the skin, lips swelling, difficulty breathing or swallowing, important to know. Any kind of shaking or tremors, if you're having trouble speaking and you have not had trouble before, if you're confused or you have any unusual changes in your behavior, you'll want to let your doctor know as well. Other things you'll want to know is tell your team if symptoms do not start to get better or you start to feel worse, even like more flu-like than feeling better. And then to treat the flu, if you're exposed and infected, you'll need to start taking the medication within 2 days of getting symptoms. And again, the medicine's not a substitute for your flu shot, so make sure you're still getting your flu shot. And again, don't lose heart that if you feel your flu shot didn't work. It did. It protected you against a lot of different strains, but it may have just been kind of bad timing or just a consequence of another strain being out there. What else should I watch out for while using this medication? Tell your team if they don't get better or your symptoms. Again, I already mentioned some of those things, but where do you keep your medicine? In the hospital, we store it for you, but at home, out of reach of children and out of reach of pets. We don't always think about pets. Store at room temperature, which is a comfortable room temperature between 59 and 86. And then always discard any unused medication after the expiration date. But in this case, you'll have hopefully finished all of your Tamiflu and you will have none left over. Thank you. I hope that helped. Please contact the pharmacy if you have any other questions about your medication. Thank you.